Governor Doyle and Melody Barnes a chance to wrap us up and share our final thoughts, at least for the moment, because this is an ongoing conversation.
Well, thank you. And if I could just ask one further question of one person, because and maybe take my time. She really represents, I think, much of what's been talked about. But Reba Rice is here. She is the director of the Lakes Community Health Care Center in Iron County, Wisconsin. Iron County, Wisconsin is a very rural county on the border of the Upper Peninsula, which should be part of Wisconsin, but that's another story. But I would like Reba really, on behalf of the kind of poor people in rural areas who desperately need health care, to just share a couple of thoughts about what she sees, what it is that those people coming into her federally qualified health center, what they see. Reba.
Thank you, Governor Doyle. Thanks, everybody. This is such an exciting conversation. I am part of a community health center, and so I'm a community organizer person, and it's just great to see, yes, the rural people and the community health center people talking about these issues together with all the folks in the suits who are good people who have children who wake up in the morning and love their children, and the doctors, and we're all good people here. So, but there are a lot of things that people who come to the community health centers face that are very similar to the things that we've heard all day today. The folks who come like Adrian to our center who are underinsured or uninsured. And we can help them with some things at the community health center, and then very quickly they're beyond us. Because we can start with prevention, and that's great. Let's make it the whole focus. But we still have people who are right now sick and who we have to take care of now. And we have all these folks come to us who are uninsured and underinsured, and they are very sick. And we can see them a little, and we can help them a little, and then we need to send them off and say good luck, and we hope everything's going to be okay. So we need much more affordable specialty care, and even the standards of care. An EKG. As soon as one of our patients needs an EKG, they're beyond our scope of service, because we're little teeny, weedy little healthcare center up on the border of Lake Superior, where there are barely any roads and nobody can get there and nobody even knows we're up there, and we're in a coffee shop. That's where we practice. So we can do something, and we're very cost effective, like my colleague was saying. That's one of the things that health centers really can offer. We are also partnership based. So just recently, Thursday actually, we opened a week ago a dental center with the partnership of the state. We got an oral health grant, the partnership of our city, Ashland, and the local community. And for a very small budget, we've opened a dental center. We're going to serve 1,500 new patients who are these children who Governor Doyle has led us to put on foster care. And so with these partnerships, we can really do a lot. We need community-based solutions. Community-based solutions. We'll say it again. So some of the other things that we are seeing, though, is the real serious increase in the number of patients who are underinsured. A good job doesn't even mean anything anymore. People still will be potentially destroyed financially with a serious illness and can't afford, because of high deductibles, to get their routine care taken care of. And then finally, something that's maybe a little bit different for the rural areas, but I know if I've got any Yoopers up here, you know this too. The geographical barriers to care are huge, huge, huge. We don't have regional transport. We have impassable roads. We have hundreds of miles between health centers or providers. And then even though we live in paradise, not everybody wants to work there, and I don't get it. But it happens, and so we rely on the offices of rural health to help us get providers, but there's a real shortage of them as well. So,
well,
thanks very much.
Reba, thank you. Thank you for, to me, Reba is an example. We've heard from so many people who are out there in so many different settings, from the big city hospitals in Detroit and Milwaukee to Iron County, Wisconsin, who are out there meeting the needs of people all the time. And to me, I'm just thrilled we have a President of the United States who has decided that he is willing to take on this issue that all across the country. We've already met 3 of our state senators, but we have 2 state representatives. Representative Mason and Richards are both here as well to show you how important this is to people in the state of Wisconsin, and I know the state of Michigan. So we're going to work really hard with you, Melody, and come up with an answer that addresses Iron County and addresses Detroit and deals with this issue all across America. Thank you, Melody.